My name is Kate Halligan. I am the nurse of Linda Bletcher. Doctor Who has prescribed a new order of Coumadin 5 milligrams PO daily for atrial fibrillation for now and for today. I'm verifying that it is the correct patient. So Linda Bletcher, 0904-1972. The MRN is 1397-63. On here, she has no known allergies. The prescription that was signed by the provider, Doctor Who, so I do know that it's a valid order. It was for Coumadin, 5 milligrams PO daily for atrial fibrillation for now and for today. I'm going to go into my Pyxis, log in, and pull that medication, doing my second medication check. So I'm going to verify that this is the correct medication, Coumadin 5 milligrams, Coumadin 5 milligrams on here. The expiration is 03/2040, so I do know that this is the correct dose. I'm going to go introduce myself to the patient and discuss what Dr. Who has prescribed for her and give her the medication. How are you doing today? Sanitizing my hand. Good. Can you verify your name and date of birth for me? Okay, good. And any allergies? No? Okay, I'm just going to check your wristband. It looks like yes, Linda Bletcher. Date of birth 0904-1972. MRN is 1397-63, and there are no allergies on her armband. And that is the same on here. Okay, Miss Linda. So Dr. Who came by and discussed with me and also you that you do have something called atrial fibrillation. Have you ever heard of that before? No? Okay. So the doctor has prescribed you a Coumadin. It's going to help because your heart rate is beating at an abnormal rate. He did prescribe you some Coumadin, 5 milligrams daily, so you're going to take this every day. When we did your lab draw this morning, it showed that your INR level and your PT was at a 1, and we normally like that between 2 and 3. So what we're going to do is we're going to start this medication here for you, monitor you, and then you'll follow up outpatient. I will say that you will be getting a lot of lab draws just to make sure that it is working in the right direction. So Coumadin is an anticoagulant. You might have also known it as a blood thinner. I do want to go over some side effects with you, okay? Some of the side effects are bleeding. So when you're brushing your teeth, make sure you're using a soft toothbrush so that you're not a lot of bleeding is coming from your gums. And then if you see any abnormal like blood in your stool or your urine, please let us know right away, okay? In your chart it says that you don't drink alcohol frequently. Is that correct? Okay, so we do want to avoid drinking alcohol while we are taking this medication because that will put you at a greater risk for bleeding, and we don't want that, okay? And now about your diet. Do you eat leafy greens and stuff like that? You do? Okay. So that is okay since you've already been eating that way. Just don't change your diet because in leafy greens we do have something called vitamin K in there, and that is a contraindication of this medication. So we just want to make sure you're not adding anything to your diet, but it's okay that you're already on it, okay? So I'm going to go into the chart. Can you verify your name and date of birth one more time? Beep. Scanning the wristband. Scanning the medication. Beep. Okay, so your name and date of birth. Okay, good. And no known allergies? Okay, good. So, do you have any difficulty swallowing? No? Okay. Can you just take a sip of water for me? Alright. Did that go down okay? Okay. So I do have this Coumadin here for you. Do you have any questions before we give this to you? Okay. Sanitize my hands. Opening the medication. All right, here's the medication. Okay, did that go down okay? Okay, good. I'm gonna document that I gave the medication. All right, here's your call light and your water. If you have any questions or need anything in the meantime, don't hesitate to call. I will be back in to check on you in about 40 minutes and see how you're doing with that new medication, okay? Okay, I closed out my tab, sanitize my hands.